49-year-old male, 3 years of refractory focal onset with impaired awareness seizures. We used to call this kind of seizures complex partial seizures. Neurologically intact at the admission. Here we have the preoperative MRI of our patient, and we can see clearly that there is a lesion located here. So my first question is, where is the location of this lesion? Is it in the frontal lobe? Is it in the temporal lobe? Is it in the insula? Is it in the basal ganglia, central core? So if we pay close attention here, this is the Sylvian fissure. So this is a temporal lobe. So the lesion is not located in the temporal lobe. And this one, what sulcus is this one? This one is the anterior limiting sulcus of the insula that continues on the surface with the junction of the anterior horizontal and the anterior ascending rami of the Sylvian fissure. So this lesion is clearly located behind the anterior limiting sulcus of the insula. So it is, most of it is located in the insula, and part of it probably will be in contact with the lentiform nucleus here. And also, this lesion is very suggestive of Cavernoma, with this black halo of hemosiderin surrounding the lesion. So for the surgery, the planning of the surgery, I have to locate the anterior limiting sulcus of insula, and then I have to approach the lesion, and I have to be careful, mainly in the removal of the medial part of the lesion, because it is very close. It is in close contact actually with the basal ganglia, with the anterior commissures over here. And now we have the coronal cut of the MRI of our patient. We can see that here is the Sylvian fissure. So the anterior limiting sulcus of insula, where the Cavernoma is located, is right on top of the MCA, M1. And see once again the Cavernoma with a halo of hemosiderin. And here we have the sagittal cut, and we can see that Cavernoma is located behind the anterior limiting sulcus of insula. So ahead of the anterior limiting sulcus, orbital gyri. Behind anterior limiting sulcus of insula is the anterior surface of the insula. So how to remove this lesion? We have decided to go to remove this lesion using the right Sarion approach. So where is Cavernoma located? So if we look here, this is the exposure after the dura opening. So I just said the anterior limiting sulcus. How can I determine where the anterior limiting sulcus of insula is located on the surface? I just said in the previous slide that the junction of the anterior horizontal and the anterior ascending rami of the Sylvian fissure is continuous, deep with the anterior limiting sulcus of insula. So my surgical strategy would be open the Sylvian fissure, locate the first and the second gyri of the insula, and locate the anterior limiting sulcus of insula. And behind the anterior limiting sulcus of insula would be the anterior surface of insula. So that's where the Cavernoma is located. So let's go to the video. This is a exposure. This is a frontal lobe. This is a temporal lobe. And here is approximately the tip of the pars triangularis. In this part of Sylvian fissure, the space is usually larger because the pars triangularis is usually naturally retracted superiorly, leaving a more space in the Sylvian fissure for you to dissect. So let's go to the video. So the first step is splitting the Sylvian fissure carefully, very slowly, steady and slowly. We can see the M1, and this is already the insula, the first gyrus, short gyrus of insula, and this is interlimiting sulcus of insula. So we can see that the cavernoma is already on the surface. It's coming to the surface very at the first short gyrus of insula. So I have to expose more. So I have to expose more, open more of the anterior limiting sulcus of insula. So continue to dissect. This is insula. This is anterior limiting sulcus. Be careful not to damage any artery or important branch. We can see this is the anterior limiting sulcus of the insula, and the color is different colors of the cortex. This is a yellowish halo of hemosiderin. We have to remove this to make the patient free of seizures. Not only remove the cavernoma, but all this yellowish tissue. And this vein, what does this vein mean? This vein means that you're close to the basal ganglia, so be careful. That's not any regular vein. That's a part of inferior striate vein. And then now I have entered the first short gyrus of the insula, and I try to surround the cavernoma, and also trying to remove the halo of the hemosiderin. So I was working around the cavernoma. Obviously, I have to remove some cortex and clean up, remove all this yellowish brain tissue, hemosiderin. So coagulating some small branches so I can cut. And here you can see the cavernoma. Now I'm working on the first short gyrus of the insula. You see, there's no need for the spatula. The section tube can serve as spatula. And continue to dissect surrounding the lesion, and be careful with the medial part of the cavernoma removal, because you'll be very close to the interperforated substance. Be careful not to damage any lenticulostriate artery. So continue the removal. Now I'm working on the most medial part of the cavernoma. And now the cavernoma is free, and then the cavernoma is finally removed. Then I have to continue. See that vein here? This vein here. This is a very it's indicating, showing you that you should stop here, because otherwise you're going to invade the basal ganglia. And here we have the post-op MRI showing the total removal of the cavernoma. The histology confirmed that the lesion was a cavernoma, and he had an uneventful postoperative course and remained neurologically intact. There was a subdural hematoma. It looked like epidural, but that was solved with conservative management. And he had 4 seizures in the first 3 years after the surgery.